Thank you for joining this presentation, which is the second of a series about the impact of COVID-19 on economies. Wednesdays was focused on the global and Australian economy. Today, I'm going to be talking a bit more briefly about the global economic impact and instead focusing on the economies of the Asian region, China, Japan briefly, and then the other economies in the arc running from Korea through Indonesia all the way to India. I hope at the end of the presentation you may have some questions. Feel free to use the chat facility to put those to me, and I'll do my best to answer them. I should also say that for subscribers, there'll be a copy of all of these charts at the end of the on the website at the end of the presentation or shortly thereafterwards. So if I've gone through something too quickly this afternoon or this morning, you'll have a chance on the website to look at anything that caught your eye in a bit more detail. Let me just run briefly through the agenda for this session. I'm going to begin with just a few very quick comments about the progress of the virus itself, then to talk about the world economy as a whole, and briefly about the two major advanced economy regions of the US and Europe. Then I'm going to turn my focus to the Asian economies, which is, of course, the major part of this presentation and presumably the reason why you're here at the moment. Let me emphasize before I do start, however, that absolutely nothing in what's to follow constitutes investment advice, nor should you construe it as such. If you think that something I've said represents a recommendation to undertake some kind of transaction, to buy or sell, then to paraphrase the former Federal Reserve Chairman Alan Greenspan, you will most certainly haven't understood what I've said. With that health warning, let's now turn to the business at hand, beginning, as I said, with a few observations about the virus itself. And the simple point I really want to make here is that globally, the virus is still out of control. There have been more than 15 million people who've caught it around the world. The curve has not been flattened. The number of new cases is continuing to set records every day. And although the number of deaths has not accelerated in the same way that it did in the first phase of the pandemic, that probably reflects the fact that an increased proportion of the number of cases now being recorded is among young people who are less likely to die of COVID-19 than people in their 50s, 60s or older age groups. There's probably also something due to the fact that health professionals are learning how to treat the most seriously ill people more effectively, and thankfully fewer of them are dying. And, or possibly third, some scientists suggest that the virus itself may be changing in ways that make it less deadly than it was initially, though it's clearly no less infectious than it was when it first came to our attention earlier this year. If we look in a little bit more detail, we can see that a majority of the cases that are now being recorded around the world are being recorded in 6 countries with large populations. That's the United States, India, Brazil, Colombia, Indonesia, and the Philippines. Most of the other large countries which had been experiencing a significant acceleration in cases, either at the beginning of this episode, such as China, or subsequently, have now, it would seem, gotten on top of their infection curves, although China has seen an acceleration in the number of new cases in the last few weeks. And of course, many countries with smaller populations, including Australia, but also Germany and Spain, and in the Asian region, Hong Kong, which previously thought they had succeeded in flattening the curve, are now experiencing what the epidemiologists call second waves. And that's obviously represents a setback not only to the prospects of getting the virus completely under control, but also to the extent that countries have had to reimpose restrictions, have meant another blow to economic activity and potentially consequences for confidence in the medium-term future once this wave hopefully has passed. If we look more closely at how Asian countries have fared, in general, and with one conspicuous exception you can see in looking at the left-hand chart, the infection and death rates in Asian countries have typically been much lower than elsewhere in the world, whether we're talking about advanced economies in North America and Europe, or other developing economies elsewhere in Asia, in the Middle East, in Africa, or in Latin America. The single exception there is, of course, Singapore, which has had very serious infections in dormitories used by its migrant workers. But even then, it's remarkable how low the death rate has been in Singapore, given the high level of infections. And clearly Singapore's health system has been more than up to the task of preventing a large number of infections relative to Singapore's population from translating into a large number of deaths. Apart from that exception, you can see that all the pink bars in the charts, which represent Asian countries, and the yellow bars, which represent Australia and New Zealand, are very much at the lower end of the infection rates, death rates, and deaths per million population. That doesn't necessarily give us cause for comfort in every case, because there's certainly evidence that a number of Asian countries, along with some other countries in different parts of the world, haven't been testing widely enough to give us confidence that they've actually detected all the cases, or even a majority of the cases that may actually be out there in their respective populations, or that all of the deaths that have occurred have been correctly attributable to COVID-19, rather than either not being reported at all or being assigned to some other probable cause. In particular, it would seem India, Indonesia, and the Philippines aren't doing nearly enough tests to provide confidence that they're actually detecting all the cases that might be circulating within their populations. As a crude generalization, and this doesn't apply in every case, countries that test a relatively small proportion of their population, but which report a relatively high number of confirmed cases for every 100 or 1,000 tests that they conduct, are probably only testing those people with the most obvious symptoms. And as we know from the experience of other countries, COVID-19 can be invisible to the people who've got it, as well as to outside observers for quite some time, during which, of course, they can quite easily pass the disease on to other people, other members of their household, or people with whom they come in contact in workplaces or just in other social gatherings, without that necessarily being detected. So in some of those countries, I don't think we can be as confident that they've controlled the virus as well as the previous set of charts would have suggested. I should say that some other countries with apparently low testing rates, such as Taiwan and Vietnam, which have clearly had considerable success in containing the spread of the virus, and in particular in keeping the number of fatalities down, have been using other ways, including very rigorous contact tracing and isolation, to prevent the spread of the virus. And in those cases, the fact that the testing rate appears very low doesn't really detract from the credibility of their results in the way that it potentially does for some of the other countries that I've just mentioned. Of course, the strategy that most countries around the world, whether they're rich countries or relatively poor countries, have deployed in their attempts to control the spread of the virus and keep their populations safe and well, has been to impose restrictions on the movements and gathering of people. And Asian countries have done that pretty much as countries in other parts of the world have done, with a couple of conspicuous exceptions, such as Taiwan and Japan, where the emphasis hasn't been so much on restrictions as on other ways of preventing the spread of the virus that have long been part of the culture, such as wearing masks, something which you'll know has been much more difficult to persuade the population to do in most obviously the United States, although it does seem to have become more widespread, more part of what people do in their daily lives in most European countries. Many Asian countries, in particular China itself, Hong Kong, Taiwan, Korea, Singapore and Thailand have been able to draw on their experiences dealing with the SARS virus in 2003 and the MERS virus in 2009 to know that they need to move quickly and what other forms of social distancing they need to enforce. And of course, their populations are familiar with what they have to do in those circumstances. And that's clearly helped some countries achieve much greater success in preventing the spread of the virus and minimizing deaths than other countries have done. What's also notable, especially from the middle chart, however, is that in general, the restrictions which were imposed in Asian countries didn't last as long, weren't maintained for as long as they were in other countries. China's an exception there, of course, because it was the first country where the virus was detected, and they had a very strict lockdown, particularly in Wuhan, for an extended period of time. The other observation I'd make here is that it's not necessarily the case that the countries which had the strictest lockdowns for the longest periods had the greatest success in containing the spread of the virus. For example, the Philippines and India have had very strict lockdowns by the measure compiled by researchers at the Oxford School of Government, the strictest lockdowns of anywhere in the world, and have kept them for relatively long periods. But as you will have noted from an earlier chart, they're among the countries who've had the least success in containing the spread of the virus, whereas countries such as Hong Kong, Japan and Taiwan, which never had restrictions more severe than 70 on the Oxford University scale, have done very well in containing the spread of the virus. There's now quite a bit of evidence from epidemiological researchers that suggests that what matters more in determining whether a country has been successful in containing the spread of the virus is how quickly they have responded once the virus has first been detected, by imposing whatever restrictions they choose to impose or introducing whatever other measures such as tracing and tracking that they choose to impose, rather than the severity of the restrictions themselves. And that's probably something that will be important in determining how successful countries are in coping with the second waves of infections that many countries or regions within countries are now starting to experience. Clearly getting on top of this as quickly as you can, rather than kidding yourself that it isn't actually happening again, seems to be critical in determining whether second waves can be contained, or alternatively, whether they become almost as serious as the initial wave might have been. That's probably about as much as I can say about the virus itself. I'm not an epidemiologist, and there are plenty of other places you can go to look into those matters in more detail from people who are more knowledgeable than me. If you'd like to see the slides again, or to look at Wednesday's presentation, which mainly focused on the Australian economy, you'll be able to find that on the website over the weekend. You can also see how to subscribe to a weekly update of these and other charts, and gain access to other material and talks that will only be available very soon to subscribers. Thank you for being here this afternoon. I hope you found these slides useful in the decisions that you may have to make about your business or your investments, or maybe they've just brought you up to speed with an important region of the world economy, whether it's where you live or one in which you take an ongoing interest. If there are any questions, I'd be delighted to do my best to attempt to answer them. But otherwise, can I again thank you for being here and look forward to engaging with you once again.